So my first talk yesterday was about validating and translating an outcome measure tools. How important that for clinicians and how they choose the appropriate tool. And we talked about the rigorous steps in translation and validation of the tool to be useful for clinicians and to get a better outcome and data. So the important finding was actually, first of all, that we have to implement a measurement tool to measure the impact of what we do on a daily practice. Otherwise, we will not be able to know what is the impact of what we are doing. Secondly, we do not need to invent a new tool. We can just use a validated tool which is used by others and sound effective. Thirdly, that we have to publish our data once we have created the tool and validate it, and the results has to come out for the public. We actually were succeeded in translating and validating ESAS, which is used in US and Canada and many other countries. It's a valid tool. The Arabic version of it will be out. We will publish it soon. Now we are taking another project by validating and translating the IPAS, which is the Integrated Palliative Outcome Scale, with Richard Harding and his group in KCL. Right, my second talk was a very important one also, because we talked about caring for refugees and disadvantaged or displaced people in the region, and from a Jordanian perspective. As we know that refugees numbers are very, very high. Jordan ranked number 4th in the MENA region to receive a large number of refugees. It impacted a lot on Jordan economically, socially, and financially. Now, the refugees have a unique problems and challenges. They flew out of their countries. They have major challenges by getting the right support from either basic support or even healthcare support. Now, cancer is a major problem too. Finding financial coverage for refugees in Jordan for cancer care is a challenge. Currently, we are doing a lot to actually build capacity for caring for refugees, for healthcare professionals, as well as the patients and their families. So we are undertaking major projects. One of them will be with King's College London and a project called Research for Health in Conflict, where we build capacity for healthcare professionals as well as clinicians, and actually building clinical skills and competencies. So the major challenge is actually to get financial support as well as sustaining funds to develop and continue what we are doing. So, treating patients costs a lot of money, and development of healthcare professionals is also costly. However, with this grant, we are hoping to deliver high quality outcomes. So we are building capacity for research in palliative care in the region. We are also building skilled professional staff to be able to take care of Jordanians and non-Jordanians. Now, this grant started early this year, and it's going to go for 3 years. We are working with different countries, with Lebanon, Turkey, and Birzeit in Palestine, and of course the principal investigator from KCL London. And we are doing also other projects, like building a national home care program in Jordan and building the palliative care program. And we recently got the strategic plan for palliative care of Jordan endorsed by the Ministry of Health with major domains to be able to deliver a good quality palliative care for all Jordanians. And of course, having the second grant in, that we will ensure that the same high quality service will be accessible and available for non-Jordanians as well. but we're starting, and now we hope that we find outcomes in the next couple of years. Yeah, my third talk is actually about the National Home Care Initiative demonstration project in Jordan. This was a financial funding grant from the USAID, with the aim of improving the home care market in Jordan. As you know, that Jordan is a low middle income country. We have a lot of financial constraints. Our hospital beds are occupied, and we need to be able to push patients out to the community and freeing beds for more acute cases. Again, also to cut down costs on the hospitals and the healthcare system, given the fact that we are a financially constrained country, especially with the refugees and others. So this program actually was to build the market for home care, improve the capacity for home health care professionals, as well as changing the policy to be able to accommodate home and palliative care in the country. The project was completed this year. We were able to train more than 1,200 healthcare professionals, and we were able to develop a complete quality improvement plan and documentation. We were able to improve and actually expand the home care services at King Hussein Cancer Center, and using that pilot as an example for the rest of the country to generate economic and operational data for them. So to use it as an example, hopefully to propagate that project outside King Hussein Cancer Center. We also, again, we developed the national policy for palliative and home care. And we are now in the process of actually publishing the data for the economic evaluation, as well as the operational and the policy data. The new grant from KCL is actually a sustainability plan for the USAID grant, which is going to continue for the next 4 years. And meanwhile, we'll be able to support ourselves and hopefully to get additional funding or self-fund the coming or upcoming activities. And now we are open to collaborate with the region in order for us to improve the quality of life for patients with cancer, providing an excellent palliative and supportive care.